Hello everyone, welcome to Nurse Pro. The purpose of this channel is to help you all to pass your OSCE exam more easily. So hopefully you can all get the nursing license and to be able to work in the UK. So today's our topic is intramuscular injection. This is one of the OSCE skill station. This video is just for sharing purpose and for the sequence that I recommend to you. It is highly recommended that you choose your own words and you arrange your own sequence. Anything that you could help yourself to memorize it better, then it's recommend you to do it. So here I recommend a framework for you. This is the framework that I think is helpful for you all to remember all the things and all the key points. And remember, you need to check the latest marking scheme because the NMC may add new points to the latest guidelines, to the latest marking scheme. Therefore, you must check the latest version so you won't miss any points. Previously, I've recorded a video regarding OSCE framework. Please refer to this video because I will go through the general steps more quickly. The main purpose of this video is the intramuscular injection. For those general steps, please refer to the OSCE framework video. But generally, when you need to do this station, first of all, point number one, before you approach your patient, you need to check the environment. It is safe, clean, the floor is clutter-free, nothing will induce patients for risk. And then you need to maintain privacy and dignity. You need to close the door or close the curtain if you are at patient's home. And also you need to perform hand hygiene. You need to perform it with 7 steps according to WHO guidelines. Afterwards, you really approach your patient. You need to say hi to your patients and do the self-introduction. Hi, Mr. Smith. My name is Ruby. I'm here to blah blah blah. Or I'm the nurse looking after you today. Something like this. And then you need to respect your patient, and then you need to ask your patient, how would you like to be called? Or how shall I address you? After that, you use a short sentence to state your aim. Why am I coming today? Yeah. And then you need to check the identity. It is a very crucial point. If you go on to talk about your procedure and you perform your procedure without checking the identity, then you fail the task. This is a very critical point. You must ensure you have the right patient. Therefore, I would recommend you to check the identity as early as possible. If you are in the hospital, please check name, date of birth, and the hospital number. May I have your full name, please? And your date of birth? I would like to check your wristbands against the medical record. Is that alright? If yes, then you continue to check. Remember, you need to read aloud the full name, dates of birth, and the hospital number. If you are in the community, remember you need to check the full name, dates of birth, and the full address. You may ask the patient, can you tell me your full address, please? After the checking, you need to continue to check the allergy. If you are in the hospital, patients will have a bracelet. You need to check if it's in white or in red. If their color is incorrect, you must do something. So you need to ask your patients, do you know, are you allergic to anything? Like medication, dressing materials, latex, or food. After the allergic check, you need to restate the aim again. But this time, you need to explain it more clearly, more detailedly. Because you need to tell the patients the whole procedure, and also you need to gain consent. Is your patient happy for you to proceed? So you need to ask, Mr. Smith, are you happy for me to proceed? Okay, after you gain the consent, you need to check the comfort. You need to ensure that your patient is psychologically and physically ready for you to perform the procedure. So you may tell your patient how long the procedure will last. For example, the procedure will last about 15 minutes. Do you need to go to the washroom beforehand? Positioning is very important. You need to ensure that the patient is having a comfortable position now. And do remind yourself, it is the time for you to position your patient, because you may need specific position for you to do the task. So this is a good opportunity for you to position your patient. For example, you need to give the intramuscular injection. Then it depends on which body parts that you are going to inject the medication. If it's a deltoid, then sitting upright will be fine. If the patients prefer buttock area, then the patient needs to lie lateral. So it really depends on the site of injection. After you prepared all these things, you may leave your patient, give a call bell first, and then you leave the patient. And then you need to prepare for your task. This station is the intramuscular injection. It's one of the OSCE skill station, and it lasts for 12 minutes. Remember, you got specific position for this task. It depends on which area that you're going to inject your medication. And for this station, you need to wear apron and a pair of non-sterile gloves. When you explain the procedure to your patients, first you need to know the reason of giving this medication. So you may say the doctor prescribed this medication for you, for your pain, for your anemia, something like this. So it depends on your scenarios. Why are you giving this medication? You need to show your examiner that you fully understand why you are giving this medication. And then you may also say, I'm here to give you your 8 o'clock intramuscular medication, for example. And you need to explain to your patients that the medication will be injected to your muscle layer. You need to give patients preferences. So you can name the sites for injections, for example, the deltoid, the upper arm, and your hips. So you may also ask your patient, did you have any intramuscular injections before? Which part did you have it last time? After you know the sites, then you may do the site rotation. If last time it was given in right arm, then this time you can give it in left arm, something like that. And then you need to check the comfort of patients. After you position the patient, you need to know if the patient is comfortable in this position now. Alright, so after that, you leave the patient and you gather your equipment, your medication. I would prefer to check the prescription first, because after checking, you can take the medication when you are preparing other equipment. So you need to read aloud the whole prescription. 5 rights is very important. Right patient, right drug, right dose, right date, time and frequency, right route, and you must check allergy, because this is the administration of medication. So for example, you are given a scenario. ABC is admitted to the medical ward. She requires her injection as below. The date is today. The time is 12 o'clock. And then the patient's detail. ABC, you need to read aloud all this. Patient's name ABC, dates of birth, blah blah blah. Hospital number, blah blah blah. Patient is allergic to blah blah blah. And then the drug given is hydroxycobalamin, for example, yeah. And then the dose is 1 milligram, and the route is intramuscular. It should be given once weekly, due today, and not yet given. You can refer to the right box. There is no signature yet, so not yet given. So it's time for you to give the medication now. And then, besides the 5 rights, please make sure that you check the doctor's signature. Signed by Dr. XYZ today. And you need to ensure that the medication has not been given yet. So on the right hand side, signature of nurse, dates and time of administration, nothing is written yet. It's the time for you to give the medication. So besides 5 rights, let me remind you all again, you need to ensure the validity of the prescription. You need to make sure the prescriber name is here. If BIP number or GP number is given to you, make sure you read it out. and you ensure the signature is here and the prescription date is here. Not yet given, so it's time for you to give it. You can also say the prescription is complete, valid, and eligible. This sentence is actually showing to the examiner that you understand and you have already checked the medication record. And then you go to prepare your equipment. You should use a tray to hold everything so that you won't be too messy, right? But before you use any equipment, you must ensure it is clean. So the examiner may tell you that all equipment has been cleaned before you start your station. If the examiner tells you that, then it's very good because you just need to use it. But if nothing is mentioned, you need to state it. You need to voice it out. Can I assume that the tray is clean? Can I assume that the tray has been cleaned by alcohol wipes, for example? Yeah. And then you use the tray, and then you check the medication. You need to check the drug name, and then you need to check the package is dry, intact, and undamaged. You need to check the expiry date, and because it is liquid inside your ampoule or vial, you need to state that it is clear and no precipitate. And then you need to prepare a 2.5 ml syringe or a 3 ml syringe. And then number 4, you need to get a 18 gauge loading, or we call it blunt drawing needle. And number 5, you need to get a 21 or 23 gauge injection needle. And also you need to prepare alcohol wipes for 2, yeah. And then you need to prepare your gauze, plaster, and your sharp balls. For intramuscular injection, in the UK, you need to switch needles. For example, like this, you got a 18 gauge loading needles. It may not be showed very clearly in the video, but actually at the tips of your needle, it is blunt end, it's not sharp. So it is used for you to draw the medication. And then after you use the blunt needle, you need to recap it and then discard it, and then you change it to an injection needle. Yeah, I will explain it later on. So after you prepared all your equipment, and you need to prepare the drug. So number 1, you need to do the hand hygiene. And then number 2, you need to use the alcohol swab to disinfect the ampoule or the vial. Remember, for all the things that you opened during your stations, any stations, first of all, you need to clean it. You need to disinfect it with the alcohol swab first. It may be the saline solution, it may be the ampoule or vial, everything. When you're going to pull out the liquid, then you need to clean the superficial area first. After you clean it and you let it dry for 30 seconds, you need to swab it for 30 seconds and then you let it dry for 30 seconds. And then number 3, you break the ampoule with a gauze. And then you connect the loading needle to the syringe. And then number 5, you aspirate the accurate amount. Make sure that it is accurate. And then number 6, because at point number 4, you are using the blunt needle, the loading needle. So now you need to recap it, but remember, very important, you need to use the single hand rescope technique. That is, you use one hand only. This is to prevent any sharp injury. After you recap it, then you disconnect it and then you discard it directly into the sharp bin. And then number 8, you change and you connect it to the injection needle. And then number 9, you ensure the accurate amount has been drawn. You also need to ensure there is no bubble. After you ensure all these, you show the syringe to your examiner. You show it the exact amount. The examiner will come and have a look. And then afterwards, you place your syringe on the tray. Then it's time for you to return to your patient, but first of all, remember hand hygiene. After hand hygiene, you need to wear apron. And then you need to prepare a pair of gloves. You should prepare a pair of gloves because it is not the time for you to give the injection immediately after you return to your patient. You also need some time for your site inspection. To avoid touching other things and contaminating your gloves, so you can bring a pair of gloves. But if you ensure that you won't touch other things, won't contaminate your sterile gloves, then you may wear it out. So this is your preference. This is your choice, and you can arrange your own sequence. And then when you're back to the patients, because you have left your patients for a while, so you should check their identity again. And also you should gain the consent again and check the allergy again. You do not want any error. And then make sure you need to ensure that patient is not having any anticoagulant. Although this point is not mentioned in the marking scheme version 1.9, but actually for intramuscular injection, we should check if the patient is having any anticoagulants. If yes, we shouldn't give the intramuscular injection. We should tell the doctor, alright? So after you ensure that no allergy, no anticoagulants, then you need to explain the effects and side effects of the medication to the patient. So there are some common drugs that we give the patients. For example, hydroxycobalamin, the Vit B12, phytomenadiol, Vit K, or diclofenac. This is an NSAID. So you need to check the effects and side effects beforehand. You need to get prepared for the examination. And then, just before you inject the medication, you need to check the injection site. You need to read aloud this sentence. You check the injection site. For example, the deltoid. You need to state that there is no signs of edema, inflammation, infection, skin lesion, and wound. Rule out all these things and use the landmark, and then you find the exact location to give the intramuscular injection. Just before you give the injection, make sure hand hygiene and wear your gloves. Remember to wear your gloves. And then for the injection steps, first we need to do the site disinfection. You use the alcohol swab to clean it, like a small circle going out to 2 cm. And then you clean the injection site for 30 seconds and then allow it dry for 30 seconds. And after that, you need to prepare the positioning. You need to use your non-dominant hand to gently stretch the skin. And then you may also ask the patients to cooperate. Ask the patients to take a deep breath. And then when patients ready, and then you ask the patients to slowly exhale. And then while patient is exhaling, then you insert the needle 90-degree angle. And then until 1 cm needle is left. So when I do these steps, I will read aloud all the steps in addition to my actions. Okay, and then number 8, for deltoid, the guidelines, the marking scheme has written that no need aspiration. So you only need to aspirate if you are injecting the medication intramuscularly at the dorsogluteal muscle. So it really depends on the site of injection. So you need to see if you are injecting at dorsogluteal or the deltoid. If it's deltoid muscle, no need to aspirate. If it is at the dorsogluteal muscle, please aspirate. Okay? And then number 9, you inject it slowly over 10 seconds. The guideline is at 1 ml per 10 seconds. So it really depends on the amount of medication. If you are giving 2 ml, then you need 20 seconds. Alright? And then number 10, you need to wait for 10 seconds to allow the drug to diffuse into the muscle tissue. Okay? You need to show the examiner that you will wait for 10 seconds. And then number 11, you withdraw the needle rapidly and then you discard it into the sharp bin. Use some gentle pressure with a sterile gauze. You applied it over the injection site and then make sure not to massage. And after that, maybe a few seconds, you remove the gauze and have a look. I need to state it, there's no bleeding. I will apply the plaster to you, alright? And then number 16 is the waste disposal. For example, your gloves, your apron, and other equipment. Following that, you need to do the hand hygiene. So when you finish your injection, quickly do the documentation because time is running out. If you didn't sign the medication record, you failed the task. So remember, grab your time, sign immediately after the injection. And then you need to sign and write the date and time if the box has asked you to write it, okay? So here you see upon plus or minus details of person administering medication. For a normal medication record, you may see there is a table. Ask you to fill the name of the administrator name. If you see this table, please write down your name. If you do not see this table, then you just complete your medication record, okay? If there are any empty space, then you can also write down the site of administration. It is a good practice so that the nurse for next shift maybe giving the next injection will know which site that you have injected this time, and they can choose another site to do the site rotation. After all the procedure, you need to reassure the patient. This is important. You need to check if the patient is comfortable after the procedure, and then you need to remind patients not to rub the injection site. So just like this, you see the right box at the right hand side, not signed yet. So you should sign it yet after you have given the medication. So then now it's time for you to leave your patient. Make sure before you leave your patients, you need to offer some support to your patients. You need to give the call bell to the patient and ask the patients to press the call bell if they need help. And also, if you are in the community, you need to advise your patients to seek help from the GP or go to the emergency department in case of emergency. You also need to ensure proper waste disposal, and you also make sure that you will clean the equipment by alcohol wipes and then make it ready for the next use. And you remember, you need to do the hand hygiene before you end the task. So actually you see there are a lot of steps, but these steps are actually reflecting that you are complying and you are acting professionally. So the code is prioritize people, practice effectively, preserve safety, promote professionalism and trust. You need to remember all these points because these points will appear again in your professional value station. So this is the end of the sharing of the intramuscular skill station. Remember, you need to position your patients, and then also you need to check 5 rights because you are giving medication. And also you need to understand all the steps for giving the intramuscular injection, whether you need to aspirate, and also what steps you need to do when you are preparing to inject. And you need to do it, inject it slowly for 10 seconds for 1 ml, okay? And then you also need to wait for another 10 seconds to allow the time for the medication to diffuse into the muscle tissue, okay? And you also need to give some aftercare. For example, you apply gentle pressure followed by the use of a plaster, okay? So remember, documentation is important. You need to sign, and then also you need to give some education to your patients regarding the effects and side effects. Okay, I hope this video is useful and you will understand more about the intramuscular injection and you can remember it more easily. Hope you all can pass your OSCE easily. So see you in the next video. If you like this sharing, please like the video and subscribe to the channel. Hope I will see you in the next video. Bye.